Are you looking for effective, natural, and practical ways to manage family planning? Understanding different methods of contraception is crucial for making informed decisions that align with your health, lifestyle, and values. In this video, we explore natural family planning, NFP, and other important contraceptive options, from the lactational amenorrhea method, LAM, to emergency contraception, dual protection, and beyond. Whether you seek non-invasive methods or need options that ensure both pregnancy prevention and STI protection, this guide covers everything you need to know to take charge of your reproductive health. Stay tuned as we break down the benefits, limitations, and key points of each method. Natural family planning. Description of natural family planning. Natural family planning refers to a variety of methods used to plan or prevent pregnancy that do not use any chemical. There are four main types: the rhythm or calendar method, the basal body temperature (BBT) method, the mucus or Billings ovulation method, the symptothermal method (STM). How the natural family planning works. It is based on identifying the female's fertile days and avoiding intercourse during the fertile days to prevent pregnancy. A trained doctor, nurse, or a counselor usually helps the female to learn how to determine the fertile period. Advantages of the natural family planning. It is safe, there are no physical side effects. Acceptable to many religious groups that oppose other contraceptive methods. Training increases the female's and sometimes the man's awareness of the reproductive system, physiology, and the menstrual cycle. Partners have shared responsibility for family planning. May help couples achieve pregnancy if pregnancy is desired. Limitations of the natural family planning. In general, less effective than other methods. Depends a lot on changes in the body temperature, requires extreme self-discipline, commitment and cooperation of both partners. Requires substantial initial and some ongoing counseling, requires daily monitoring, charting, record-keeping. Sexual abstinence may cause marital difficulties. Sexual intercourse must be confined to a limited number of days. It does not give protection from STIs, including HIV. Lactational amenorrhea method, LAM. Description: lactational amenorrhea method. LAM is the use of breastfeeding as a temporary family planning method. It provides natural protection against pregnancy and encourages couples to start making alternate arrangements for another family planning method at the proper time. How the lactational amenorrhea method works. A baby's suckling suppresses the production of the hormones that are necessary for ovulation, and without ovulation pregnancy cannot take place. When can LAM be used? A female is naturally protected against pregnancy when 1. She exclusively breastfeeds her baby, including feeding at night and on demand. 2. Her menstrual period has not returned after delivery. 3. Her baby is less than 6 months old. Advantages of lactational amenorrhea method. LAM ensures that the baby gets needed nutrients and protection from diseases. LAM is highly effective and easy to use. No supplies are needed. LAM does not interfere with sex. It has no side effects. It has health benefits for both mother and infant. It encourages bonding between mother and baby. Limitations of lactational amenorrhea method. LAM is not an option for females who do not breastfeed. Exclusive breastfeeding, on demand, may be difficult to maintain, especially by working mothers. Duration of the method is limited. There is no protection against STIs, including HIV. Emergency contraception. Description. Emergency contraception is used to help a female from getting pregnant after she has had unprotected sex. There are two types of emergency contraceptives: emergency contraceptive pills, ECP. Intrauterine devices, IUD. The emergency contraceptive pill. A female takes the pills as soon as possible after having unprotected sexual intercourse, or when her regular contraceptive fails, or when she has been forced to have sex, i.e. raped. The emergency contraceptive pill is not the same as abortion pills. It will not abort pregnancy once it has started. Advantages of the emergency contraceptive pill. A female can use the ECP right away or up to 3 days after sexual intercourse. The pills have no long-term or serious discomforts and it is safe for almost every woman. It can be obtained at the clinic, drugstores or pharmacy shops. It is safe, effective and easy to use. Intrauterine contraceptive device, IUD. When inserted within 5 days of unprotected sexual intercourse, copper-bearing IUDs prevent the sperm from meeting the egg. It can be left in place as a regular method. Dual protection. Description. Dual protection is the use of condoms, either male or female, to prevent both unintended pregnancy and STIs, including HIV. Only condoms prevent STIs and HIV. Using the pill, injectable, or implants does not protect you against STIs including HIV. Therefore, double method use like male or female condom with any other family planning method is highly effective at protecting you against STIs including HIV as well as unintended pregnancy. Delaying or avoiding sexual activity, abstinence, is a good choice for adolescents or unmarried adults. Timing of method initiation by breastfeeding and non-breastfeeding women method. LAM. For breastfeeding women, immediately and could be used for up to 6 months postpartum. For non-breastfeeding women, cannot use this method. Method. IUD. For both breastfeeding women and non-breastfeeding women, within 48 hours after delivery anytime starting 4 weeks postpartum. Method. Condoms, spermicides. For both breastfeeding women and non-breastfeeding women, after cessation of bleeding and discharge and healing of abrasions, wounds and incisions. Method. Progestin-only pills. For breastfeeding women, 6 weeks postpartum. For non-breastfeeding women, immediately after delivery. Method. Progestin-only injectable, implants. For breastfeeding women, 6 weeks postpartum. For non-breastfeeding women, immediately after delivery. Method. Combined estrogen-progestin injectable. For both breastfeeding women, 6 months postpartum. For non-breastfeeding women, 3 weeks postpartum. Method. Natural family planning. For both breastfeeding women and non-breastfeeding women, can begin once regular menses returns, preferably 6 months onwards. Method. LNGIUS. For both breastfeeding women and non-breastfeeding women, 4 weeks after giving birth. Note: mother must practice exclusive breastfeeding. Her menstrual period must not have returned and baby should be less than 6 months old.